Alachua County Community Support Services Director Elmira Warren has been with the county since 1978. During her tenure with the county, Elmira has served as Senior Services Division Director, Foster Grandparent Program Director, and the Retired and Senior Volunteer Program Director. Elmira received a BA in Sociology from Fisk University in Nashville and an MA in Urban and Regional Planning, also from Fisk. Elmira's professional affiliations include the Board of Directors of the National Association of County Human Services Administrators, the Executive Committee of the Florida Association of County Human Service Administrators, the Board of Directors of the Alachua County Federally Qualified Health Center, and the Gainesville chapter of the National Forum of Black Public Administrators. Welcome, Elmira.
It's a pleasure to be here.
Elmira, as you know, we're doing a series of interviews over these last couple of months of department directors that will kind of give us a County Government 101 series of videos that people can go to the website and watch and learn an overview of each county department. And I'm so pleased to have you here for your second interview with us. And I think you know, with your department, you have such a wide variety of divisions. Let's just dive right into it.
All right.
Social Services is one of your divisions.
Yes.
Can you tell us what the Social Services Division does?
Yes, the Social Services Division primarily provides general assistance to help individuals with rent and utility payments. We also assist with paying for pharmaceutical needs. We are responsible by the state to pay for indigent burials, and that's for individuals who can't afford to pay, unclaimed bodies, that we are responsible for and making sure that they are taken care of as well.
And that's a state mandate.
That is a state mandate.
Mm-hmm.
Within our social services, we're also responsible for refuge payments. Say for if individual lives in the unincorporated area and they aren't able to pay for their refuge collection, they can come in and we can look at their budget and see if they will be eligible to have that paid by the county on their behalf.
I see. So this is a way to subsidize their trash pickup, in effect, if they can't afford it?
You're absolutely right. This is what we do to help those citizens that can't afford to pay for that.
One of the things that I know Candy Nixon, who I guess is your director of your manager of your social services program. Tell me about the NACO prescription drug discount card. That's been an amazing effort.
It is amazing and exciting for our county as well as our division of social services, because what we do is provide a discount card to all Alachua County citizens. You don't have to be any age, you don't have to be a particular income level, you just have to be an Alachua County resident. And that discount card will provide you up to 20% of a discount on your prescription medications.
And this was made available through the National Association?
The National Association of Counties provides this as a service to its county members. And we are very much involved with NACO, and we started this approximately maybe 2 years ago. And we have been able to save our Alachua County residents over the past year, I think probably over $400,000.
Is that right?
Yes.
Towards the price of those
Absolutely.
prescriptions. Do the social services workers in that division, I imagine they get lots of questions and end up referring people to other agencies and available services, so they kind of act as an all-knowing sort of input system.
You're right, Mark. That is one of the services that we provide, information and referral. If you don't know where to go, if you think you may be eligible for services and you don't know where to go, you can call us or you come by our office and we'll be more than happy to provide information and referral to you. One of the other services we provide within social services is vision care, and we pay for eyeglasses for individuals. Can you imagine someone trying to get a job and not being able to read or to see adequately?
Right.
And so we assist in that way.
And all of your programs have certain qualifications based on income or different
Yes.
factors?
Within social services, we do provide assistance to individuals that are 150% of the federal poverty level.
I see. Another division you have, and I've had the great pleasure of interviewing Jim Lynch several times. I think he may be our most interviewed guest on the show. He's no longer, he recently retired, but he
Yes.
headed up your
Veterans Services.
Right,
Absolutely.
right. Tell us about the services that they provide, Veterans Services provides.
You know, we are very fortunate in Alachua County to have a very well-respected veteran service within our county. And as you said, Jim Lynch has retired, but we're going to be replacing him hopefully with someone that's just as good as Jim.
Those are some big shoes to fill.
You're right. But we provide services to veterans and their dependents, to their children, to their spouses. We assist them with making sure that they get what they are due based on the contributions of their loved one as a result of working in serving in the armed services. We do nursing home visits. We also do home visits. We attend and are involved in local veteran organizations. Just because someone is a veteran, I think sometimes we think they know it all in terms of what's available to them, but we've found this not to be the case.
Right.
And so networking, being able to attend organizations and agencies and let them know what we do provide does help in letting veterans know what they are due.
I know in talking to Jim, he said one of the most important functions is just to help people navigate through the complexities of trying to get your federal benefits as a veteran.
You're right. And sometimes it takes as long as 5 to 7 years to go through that whole process. And our veteran service counselors hold their hands the entire way.
Right. I know, unfortunately, a number of our homeless citizens are veterans, and I know that the office works very well with them and does a lot of different events, like you had
Yes.
mentioned before the show started that there was the homeless stand down.
Yes, that stand down is going to be held February 3rd and 4th in 2011. Our office of Veteran Services, along with our poverty reduction program, work together, and that will be held next year. And it's an opportunity to help those veterans that are homeless and other veterans to make sure that they have just basic things like their driver's license or ID. If they need immunizations, we've had that available to them in the past. So it's a one-stop opportunity for veterans to come together and to get those services or to be referred to agencies that can provide additional services to them.
And throughout this interview, we'll be putting the phone numbers for all these different divisions on the screen. Speaking of helping folks, which I guess is
That's
in a
what we
nutshell
do.
what all your departments do, your divisions do. Tell me about the Crisis Center, Elmira.
The Crisis Center is one of those wonderful programs that's available to, again, all of our citizens. Sometimes there is a belief that you have to be within a certain income to receive our services. That is true for some of them, but the Crisis Center is not one of them. The Crisis Center is mainly involved with suicide prevention and crisis intervention. And you and I know, Mark, that no matter where you live or where you come from, we all experience or know someone that has experienced a crisis in their personal lives. And we provide phone coverage so that if someone has a crisis that they're going through, that they can call, and that's 24 hours a day.
Really?
We stay open, and 24 hours a day, 7 days a week, every day of the year. So while you and I are having Christmas dinner or enjoying New Year's, we have volunteers that are manning those phones, responding to crisis situations.
It's funny, the crisis center is kind of ahead of the curve when it comes to new normal. You mentioned volunteers. That's the majority of their staff, isn't it?
Well, you can definitely say that the county really gets the bang for their buck when it comes to the crisis center.
Yeah.
We have 5 staff and approximately 120 part-time staff, or we say unpaid staff, that provide services to our community. They not only man the phones 24 hours, but they also have care teams. Care teams consist of highly skilled individuals who come to your home, to your job, to wherever the crisis or situation may be, and they provide assistance. The Alachua County Sheriff's Office, as well as the Gainesville Police Department, use the crisis center as well. And so they are available to provide assistance. For example, if a bank has been robbed, which happened not too long ago, and people are traumatized, the crisis center is called and they respond immediately.
I know they're also very active during emergency situations with the rumor control hotline.
Mark, you're absolutely right about this. Our rumor control service is one that has received national recognition, and other communities have adopted rumor control as a result of us initiating that program within Alachua County. And it not only occurs during declared hurricane events, but through other situations where there is a need to keep the public informed of what actually is happening. And you know how easy it is for rumors to start.
Right. I know one of their recent activations was during the whole Dove Outreach Church potential Koran burning
You're
event.
right.
Gosh, you have so many divisions. Victim Services, very important division in your department. Tell me about that.
We are very fortunate again to have a service that is a rape crisis center certified facility within our department and for Alachua County. It is the only one in Alachua County and the only certified rape crisis center in the 8th Judicial District. We provide accompaniment through the criminal justice system. If someone is assaulted or raped, we respond the hospital so that that person doesn't have to go through that trauma by themselves, but has a specialized counselor who comes to their assistance to help them with what their rights are, what they should do, providing them with clothes, following up with them on a long-term basis.
I know you had told me before that they were a founding member of the, is it the Rape Assist National Hotline?
They are involved with that national hotline. And we have also within our Victim Services and Rape Crisis Center a 24-hour number where individuals can call also to get a help. And we provide that, and that's manned with volunteers as well.
And they also provide free HIV/AIDS
Free
screening?
confidential HIV/AIDS testing within our office. That's done. So you could come in as if you're coming for any service. We don't know why you're coming. And you can have that confidential testing done right within the Victim Services Division.
Elmira, I know that back in 2004, when the voters approved the Choices Healthcare program, that division made its way to your department for obvious reasons. And tell us about Choices for those who don't know.
Choices is a program that provides or pays for health care services, primarily primary health care for individuals that are 200% of poverty. They have to be working though.
Right.
They're working uninsured individuals that are eligible for health care services and dental services as well. You know, I understand that initially this program was very controversial and it only passed by a small amount, but I tell you, when I attend national meetings and even state meetings, my counterparts are very impressed that we have such a service within our community. And even though there was a slow growth initially, once the word got out and people really understood the benefits of Choices, our numbers have grown tremendously.
Right.
And over the past year, it's grown over 1,000. We currently have about 3,400 people that are in the Choices program.
And you've had a pretty eventful year in terms of Choices. I know you have a new relationship with Blue Cross Blue Shield. Tell us about that.
Yes, Blue Cross Blue Shield is responsible for assisting us with paying our bills and for expanding our network of service providers. And I think that has been expanded by 200 service providers for our Choices recipients, so that they have a card just like you and I do, and they go to a doctor and they receive services, and they're treated just the same.
Right. Choices, I know, was involved in a very innovative project, the Mobile Health Clinic, and I think that was a partnership with Shands.
With the University of Florida, yes, School of Medicine. And what we have done, we've donated or given $100,000 to this program to mobilize a bus that travels not only in urban Gainesville, but in rural Alachua County as well. So individuals can get screenings and receive assistance through this bus coming into their community.
Right.
So if they can't make it into Gainesville, we come to them. And it's been very well accepted. Again, it grew slowly, but now they're making stops, and they are really getting a very receptive crowd to come to get assistance.
Another project that the focus seems to be children, but it's really working, I think, to keeping everyone healthy, is the Flu Mist program.
You're right, Mark. This is a program that we have, when I say the Choices program, has provided $80,000 in funding to assist the health department to give immunizations to children. We all know if you have children or around children, children very much come home with the flu, they come home with colds, and it spreads throughout the family.
Right.
If we can immunize the children, then that can, and it does, reduce the number of illnesses that occur within the home. And so it's very successful, and we're very pleased to be a part of it.
Great. The Choices Health and Wellness program, what does that involve?
Oh, yeah. That means learning about how you can be healthy and doing those healthy things such as eating right and exercising that will keep you and I from becoming ill. And so I know you've heard of Zumba. Zumba is an exercise in which people can go in if you have chronic diseases, hypertension, diabetes, and you want to hopefully improve your health. And even if you're a healthy person and you want to prevent from getting ill, you can get involved with our health education and our exercise programs. So prevention is very important.
You also have the Community Partnership Division. Am I getting that right?
You're right. That's
okay.
One of our new divisions. We lost a position, senior services position, and so we have a Community Partnership Division that consists of the Community Agency Partnership Program, which is CAP.
Right. And
CAP is the competitive funding process for nonprofit organizations and agencies that want to get funding. Right. And also the Retired and Senior Volunteer Program and the Foster Grandparent Program. All three are under Community Partnership.
So that was a cost-saving measure?
That was a cost-saving measure, and Lee Roberts is the manager that is over those three programs.
And then there's Partners for a Productive Community, and I know that's that division that kind of concentrates in the Southwest area.
You're right. The Partners for a Productive Community, we call it PPC, is responsible for community revitalization. We go into the community, we help to empower the residents that live there, we survey them to find out what their needs are, and we try to develop resources to assist those community individuals and groups of people that are interested in helping themselves. It started in Southwest, but we are now starting activities in East Gainesville as well.
There's the group known as the SWAG group. that I guess has been in the news a lot recently about very specific
You're right.
projects.
The county has been very instrumental in working with Southwest Advocacy Group, is what SWAG stands for. And our PPC program works actively with SWAG to increase the resources, to immobilize the individuals within those communities, to improve the living conditions of those living in that area. The health department will be going out and starting a clinic once the county has gone through the process of working with SWAG to renovate a couple of buildings there.
This is for a community
center. And this is for a community center. You're absolutely right. The library is involved. The sheriff's department is involved. There are very many stakeholders that are involved with this SWAG effort.
And this is to concentrate on giving kids a place to be, particularly during those after school till the parents get home
You're right.
hours.
For tutoring and providing those services that are germane for a healthy community.
I can't believe how long your division list is. I'm not done yet. You also house the poverty reduction program.
You're right.
And that's been involved in so many very high-profile things in recent years.
Poverty reduction program has been involved with the 10-year plan to end homelessness. We have been involved with assisting with holding hunger summits, which has led ultimately to a hunger abatement plan for our community. And so we're looking at implementing that plan now, as well as implementing the 10-year plan to end homelessness. The poverty reduction program looks at the big picture. They're involved also with the stand down, which will be held in February.
Right.
And
that crosses multiple division lines.
Right. And one of the innovative things that has taken place as a result of the PRAB, Poverty Reduction Advisory Board, is that there are food stamp that are now being used by homeless individuals by using a card and going to restaurants to eat. Isn't that unique?
It is.
That individuals who don't have the facilities because they're homeless can go to a restaurant and have a good, hot, nourishing meal.
And I think you've been pretty deliberate at picking reasonably priced restaurants that will stretch that dollar. Yeah. The One Stop Homeless, or the 10-year plan to end homelessness, has been an amazing process to watch, and I know this has involved a very close partnership with the city of Gainesville, and is ultimately going to result in the one-stop center that is being built that the County Commission has been a part of throughout.
The city of Gainesville, as well as the Office on Homelessness, they're all a part of this effort.
Yeah. And the hunger abatement plan, I know there have been and continue to be large meetings that bring together huge numbers of stakeholders. And John Skelly, I guess, in your office, has been the county liaison there?
Yes, he has been.
Yeah. Elmira, I know another, and this is kind of an interesting, not that they're not all interesting, but the relationship with the cooperative extension in your office. I know that's a good example of a partnership with the University of Florida, but for those who don't know, tell us what the cooperative extension is and how it relates to your department.
All right. The Cooperative Extension Office is the off-campus branch of IFAS, and IFAS stands for Institute of Food and Agricultural Science. And what IFAS is responsible for, or let's say our Cooperative Extension Office, is responsible for providing scientifically based information in various areas. Those areas include agriculture, horticulture, family and consumer sciences, and 4-H. Those are the four main areas that scientific information is given to those people who are farmers, are individuals who have gardens. We do various things in cooperative extension.
I know they offer a fascinating series of classes, everything from you know, cooking classes to how to plan your finances.
That's right.
If you're a newlywed couple, they have pre-getting married
Tying
classes.
the knot.
Tying the knot.
That's the name of the class.
Yeah. And is this jointly funded by both UF and the county, or how does that work?
Yes, it is. The county provides, I'd just say approximately 40% of the funding, and the University of Florida provides the other 60%.
Well, Elmira, thank you so much for coming back on. It's always so nice
Mark,
to see you.
thank you so much for having me.